Good evening. I'm Dr. Leyla from Istanbul. We are now in Corsets clinic. I just want to talk about BBL today. It's Brazilian butt lift. It's a procedure that we do liposuction and then transfer the fat tissue to the buttocks area. So this will be in English. So it's supposed to see my English patients and my also international patients and to answer their questions. So if you have any question, just let us know and be in contact, please. Okay, so we have the procedure and we have some questions, and I will answer the questions that you're asking in the internet. So shall I basically tell the procedure? Okay. So it's mainly the liposuction procedure, liposuction and fat transfer procedure. What I'm mainly using is laser. I do laser liposuction to all my patients when I want to do liposuction. Then if you want to do any BBL procedure, then we transfer all the fat to shape the usually body first mainly, and then the buttocks area. That's why we tell that procedure Brazilian butt lift. The aim is looking like a Brazilian buttocks shape, but of course we shape all the body. What is that? It's like a more round, a more perky buttocks area, more narrower waistline, and more straight abdominal area. It's shaping actually all these areas, and then the buttocks area. So we're not aiming just the buttocks area, not shaping all. We're basically aiming all the body. So then it will be more balanced body. So where we put the fat tissue, we usually using all the levels, which is inside of the muscle area, because it's a very big muscle area in the buttocks. So then it's called gluteus maximus and gluteus minoris. We usually don't use the between the two muscles. Inside of the gluteus maximus area, upper side of the gluteus maximus, and then soft tissue, all the levels of the buttocks area, plus the just the subcutaneous tissue, which is just underlying of the skin. So basically our aim is to shape the body and also to control the cellulitis and the skin quality. So we are using all the levels of the buttocks area, and then we shape plus the waistline. So all of this called BBL, Brazilian butt lift procedure. That's it. One of the questions is there an age limit of the surgery? All kind of surgeries. The surgeries are usually aesthetic procedures, that must surgeries. So we usually wait at least 18 of age. So when the people are 18, usually we start using these operations, this kind of operations. But mainly I prefer to do it after 20s. And if the medical issues and everything is fine, then I can do it over 20s. How long is the recovery time? The recovery time is usually, I can make like a limit of some time. I mean, it's not a certain time. We usually give a range of time because every patient is different. Or even we do fat transfer like 500 cc, 300 cc, and or 1000 cc. So they're all different according to the fat that we transferred. So basically it's between 1 week to 8 weeks of the recovery time. What's the usual time is usually like 2 weeks. When can I go to the sea after the surgery? Basically, if it's not a combined procedure, if it's only a liposuction and fat transfer, like BBL procedure, I usually say 2 weeks. 2 weeks we wait for the incision lines. They are very small holes. Then when they close, then you can swim anytime. So this is about the incisions, and this is about the healing part of the incision. So it's usually 2 weeks. Is there any visible scarring after the surgery? How good do they heal? It's also depending on the patient and depending on the healing process, but usually maximum it's 2 weeks. So the visible scar is not we see because all the scars we're hiding, or we put in the hidden areas, in the bikini lines, in the especially on the buttocks area, in between of the crisis and the down part, subgluteal part, in the lower part of the buttocks area. So there is not a seen scar. The other one is, how long should I wait after giving birth to go under BBL surgery? This is usually, if you give birth after like 6 months, I usually wait for all kind of hormones on the stable level, because they usually affect the bleeding, affect the fat tissue. Even though we do a fat transfer, then they can absorb more because of the hormonal or anything that in the pregnancy level of the woman. So I usually wait just after giving birth, like at least 6 months. Do I need to wear a corset after BBL? Yes, we usually use a corset. This is between 2 weeks to 1 month, usually. I usually do BBL, but we combine with the body shaping. So I usually mostly use the pressure garment. How long does the surgery last? This is the question for all kind of liposuction and fat transfers. Usually it stays like if you're routinely, if you're doing sports, if you're doing diet or like a normal diet for a longer time period. So it's up to the patient that you keep it more. Normally my patients who are doing sports routinely and they are taking care that what they are eating are the best patients, so they can keep the result for a longer time period. But when you have this surgery and after that you don't take care of what you're eating and your diet, it may change, but not too much, because especially liposuction areas, when we take with laser, it's a kind of technology like ultrasound. So when we remove the fat, especially the areas that we don't like, the fat will never come to that areas again. So, and when we put them in the buttocks area, then when you gain weight in the buttocks area. So the changing will be not to gain in the areas that we remove the fat, but the change is usually on the areas that we add fat actually, because then what's the changes, you will have a more bigger buttocks. So if you like it more, then you can have it. If you don't like, if you want to keep the results, so you have to take care. How does pre and post-operation process go? If you're overweight, like we usually keep looking at the body mass index. If it's like this, it's usually we take care of it. We usually do this kind of operations not over 28 of body mass index size. So pre-op of this BBL procedure, we usually take care of your size, your body mass index, and how much that we have to remove from your body, and how we can get shape of all of your body. And the post-op part, we usually have some massage and lymphatic drainage for the part that we did liposuction. The areas that we add fat, we usually don't touch, to not to lose any part of this fat that we transferred. And using the pressure garment, as I told before, like at least 2 weeks. So we're trying to keep them at the same position and part. What else? Do you advise silicone implants for those who are not qualified for BBL? Yes, there is not any other choice actually. But sometimes also we combine. We combine for very not for the very slim patients, but who has some fat tissue to smooth the areas that we put the silicone implants. We combine. That we actually do for the breast implants and with fat transfer. We do it for BBL procedure. We do butt lift with the implants, silicone implants, and then we soft the areas that, especially in the junctional areas, with the fat transfer. So we combine sometimes, but if the patient is very slim, then yes, the silicone implants is the only choice that we can have the buttocks area bigger. What are the suggestions for you, doctor, regarding BBL? Actually, there is no other choice like silicone implants, fat transfer. I usually don't use hyaluronic acid, except hyaluronic acid fillers, but fillers can be the other choice. If the skin quality is good to have like a bigger buttocks area, I mean, if you don't need a lift, then we can use also fillers. There's available fillers for buttocks area, which is more dense. The density of the hyaluronic acid is higher than we apply to the face area, so they may remain longer time. So basically, if the patient is not doesn't want silicone or doesn't want fat transfer, then the other choice is the hyaluronic acid fillers that I can use. Is leg and waist slimming possible in? Yes, basically. I mean, in BBL operations, we also shape the body. As I told before, we slim the body mostly, especially in the leg area and the waist area, and also the abdominal area. So, because this part is usually it's like a unique part. I mean, the buttocks you cannot make a difference from the other side. You have to combine all of them and then shape the body. So yes, we do all together to shape all the body, especially under this part of the body. Can butt enhancement operations be combined with other plastic operations? This is the same question actually. For the liposuction, especially to these areas, the buttocks area, especially the upper legs we call thighs, and breast we can manage later, but especially the abdominal area, the back part, waistline, low handles, and buttocks area, and the thighs, they're all together. We have to shape all together. If we do one part, then it may look so different or so weird. So we have to change this appearance at once. Also, we can combine it with tummy tuck surgery or 360 body lifts. We call it 360 body lift procedure. So we can do it all together if it's needed. So, okay. Okay, any questions that we have, then I will be answering.
No, not here.
Okay. So thanks for watching, and if you contact, we'll see you later. Bye bye.